My name is Matt Jacobson. I'm the founder of Signature MD. I would like to thank all of you for joining us this evening, but more importantly, I'd like to thank you for your dedication during this time of crisis. Dr. May and Dr. Saltman, as always, thank you very much for generously volunteering your time for this meeting. I imagine that most of you are here because this pandemic has not only put the country's entire healthcare system to the test, but has also strained your private practice. Many of your practices were already under tremendous strain. You've been battling increasing overhead, added administrative burden, the dreaded electronic health record integrations, and recurring reimbursement cuts. And just when you thought things couldn't get any worse, your entire world has changed. For some of you, this has meant sheltering in place at home and operating your practice via new telehealth technology. Many of the physicians that we speak to have reported revenue drops of 50, even up to 80%. Others of you have bravely continued seeing patients, putting yourself at harm's way, oftentimes without the proper protective gear. I think we can all agree that we've reached a crossroads for primary care. Before Dr. May and Dr. Saltman share their stories with you, I'd like to go over the three different models for concierge medicine just to frame up this conversation. The model you're probably most familiar with is the full conversion model. It is a low certainty, low reward model. It's a model where you'll typically start with 2,000 patients and convert over anywhere between 200, 300, 400 patients, and unfortunately have to terminate the rest. We say it's low certainty and low reward because there is no guarantee you're going to hit your financial parity number, and it's low reward because your typical best case scenario is economic parity. Another model, hybrid model, which Signature MD does not do, is a high certainty, low reward model. It's high certainty because there is really no risk. One doctor delivers the same two distinct levels of care to two distinct patient groups. And it's low reward because typically the yield is only 25 to 75 patients because it's all carrot, no stick. And then lastly, there's the Signature MD model. We call it the segmented model. 80% of our doctors do this model. 20% actually do the full conversion model. It's a high certainty, high reward model. In that high certainty, there's no patient termination, and high reward because it's completely additive to your practice. I'll explain that here. So we are very similar to the full conversion model in how we message to patients. We tell them, if you want to keep seeing your doctor, like Dr. Saltman, you'll need to pay your concierge membership fee. Where we differ is that we don't terminate any non-member patients. So it's additive. So our typical practice yields anywhere between 200 and 600 patients, and we typically have 2 to 3% attrition for the non-member patients. The non-members are taken care of either by a nurse practitioner, physician's assistant, or an additional physician. So enough about our model. Let's get to the main event here. I'd like to introduce you to Drs. May and Saltman. Dr. Lawrence May graduated magna cum laude in economics from Harvard College. He attained his MD from Harvard Medical School and completed his residency at Massachusetts General. Dr. May began his career on the full-time faculty at UCLA as Director of Health Services Research at Wadsworth Veterans Affairs and Associate Director of the Center of Health Enhancement at UCLA. He remained as an Associate Professor on the clinical faculty. Some might even say that Dr. May wrote the book on primary care, literally, as he was the author of the textbook entitled Primary Care Medicine. Robert Saltman graduated summa cum laude in chemistry from Yale University. He attained his MD from Washington University and completed his residency in internal medicine and fellowship in endocrinology at Barnes Hospital at WashU. Dr. Saltman is a clinical associate professor at Washington University School of Medicine and has been in practice in St. Louis for the past 34 years. Dr. Saltman was the first endocrinologist in the US to integrate a concierge internal medicine practice with its broad-based subspecialty practice. So Bob and Larry, thank you very much for your time. Now we will get to what everyone's here to listen to, which is the discussion of your practices and how they've been insulated from the fallout induced by the pandemic. So Larry, let's start with you first, please. Could you please describe your practice model before and after partnering with Signature MD?
Well, I practice under every model. I practice in the San Fernando Valley, which is a suburban area of LA. And for most of my career, I had a large practice with 6 other physicians who were employed by me, and we had full ancillaries. Then for a number of years, I worked for a hospital under an MSO. And in May of 2016, I went from my 12,000 square foot office to a 1,200 square foot office as a traditional solo practitioner without the ancillaries. And I integrated they asked for it, concierge practice. And then I talked to Matt about a year into that and integrated with Signature with their recruitment of my patients and my adding a capitated Medicare Advantage component for patients who could not afford the concierge fee but wanted to maintain the relationship. And when Matt says segmented, it's very personalized segmentation because he doesn't preclude my scholarship being patients who didn't want the capitation, who I liked, I knew they couldn't afford it, and I continue to see them. For the rest of the patients, I hired a physician, a board-certified internist rheumatologist who used to work for me, and that enabled every patient who wanted to stay in the practice and still have a relationship with me, that I know what was happening and I could consult on them with my new associate. And he saw those PPO and Medicare patients who did not want capitation and did not want to pay the retainer fee.
Thanks, Larry. Bob, same question. Could you please describe your practice model before and after partnering with Signature MD?
Absolutely. First of all, good evening to everybody, and thank you, Matt, for inviting me to participate with Larry in this webinar. A little bit about my practice. I'm here in St. Louis. We have and always have had a very close affiliation with Barnes Hospital and Washington University. It's definitely a unique practice in the sense that currently all of my primary care patients are personalized care, but I have a full consultative and clinical endocrinology practice, which is completely traditional. And I have to preface with this remark, I did not find primary care so that I could pursue personalized care. This is really something that I've always done, both primary care and endocrinology. A little bit of background on the practice. Prior to this transition, it was a very thriving, financially viable practice, about 3,000 patient panel. I would see about 20 to 25 patients a day. And initially it was manageable, but as I think all of you are aware and have experienced, as the administrative and bureaucratic obstacles flourished, it became increasingly difficult to provide that comprehensive, preventive, proactive level of care to which both I and my patients had become accustomed. I worked long hours. I brought 3 hours of work home with me every evening. My wife would joke that my patients were going to live for ripe old age and I was going to die early. And it became increasingly difficult. And by 2010, it was very clear that with that number of patients, there is no way that I could sustain that model, and I had to make a choice. Either I had to accept the fact that I could not provide that level of care that was so important to me and would be disappointing not to do, or I had to pursue another model, and it was obvious that I chose the latter. The initial entities that I had interaction with were really frustrating. They were very cookie cutter and rigid. And then I happened to stumble across Signature MD, which I say to this day is the best stumble that I've ever made. And it was immediately obvious that Signature was very supportive of a customized practice model. And they understood that physicians and patients and communities had different needs. And so when I presented them with my model, which was to provide personalized care for the primary care patients, to continue traditional care for the endocrinology patients and to bring in a young physician to take care of those patients who did not want to opt for personalized care. They were totally supportive, and that met my needs because it would allow me to accomplish and continue to provide that level of care that was so important to me. It meant that all of my patients had an option, nobody was terminated, and they were all very comfortable with that. It allowed me to continue to be a resource to my community and provide endocrinology care. And most importantly, it allowed me to develop a lifestyle that was sustainable. Currently, I usually work till about 4 to 5 o'clock in the evening. I'm home by then. I don't bring any work home with me because all the work is accomplished. And it's a very, very rewarding and satisfying development. I think there are 2 additional unanticipated benefits. One is because I have so much more time, I literally have more time even to take care of the consultative endocrine patients. So in a sense, they're almost getting concierge endocrine care, and they don't have to pay a fee for it. And this is not at all what motivated me, but the financial benefits have been very impressive.
Wonderful. Thank you very much. Larry, can you tell us how the pandemic has affected your practice? And maybe you could describe a typical day or week pre and post onset of pandemic.
Well, I can give you 4 elements. When I had my solo practice with a small concierge component, I would see 30, 35 people each day. And a day for me is just a morning, but I start at 7 and I end at noon. When the pandemic hit, well, first, when I went to concierge, instead of seeing 30, 35 people, I started to see 18, 20 people in those mornings. And I felt that I wasn't working and I had so much more time with each patient. When the pandemic hit, a lot of people didn't want to come in, and I was seeing 10, 12, 13 people. And then the pandemic hit me. I saw a patient with COVID. I self-isolated so that I've been home for the last almost 3 weeks. My associate is still in the office, but most of my patients haven't been seeing him, and most patients don't want to come to the office. So we do telemedicine. I do lots of texting and phone calls, which I do all the time for my concierge patients. And in a simple metric, our collections or billings from our office practice, which used to cover all the overhead and pay me a nice salary independent of the concierge fees, that has disappeared. It will be maybe 30% of what it was. Probably I could have maintained 50% if I was coming in, and I hope to next week. But I got hit twice, both personally and the general context of patients not wanting to come out of their house.
Great. Larry, what actions have you taken or explored to help mitigate the fee-for-service loss?
Well, one is obviously we've started to charge for telemedicine, but those are only the patients who call the office and want to have a scheduled Zoom or FaceTime appointment with me. Secondly, I did apply for the loan under the payment protection or whatever the government calls it, to cover 2.5 times my payroll. Now, I never would cut off the salaries of my patients or furlough them, of my employees, I should say, or my employed doctor. And this will obviously help. And we got it in the first day, but we haven't heard anything other than from my bank that we have everything in place, but no offer of the loan, which would later be forgiven. The last things that I have, which I've done because of Matt, is I piloted a remote monitoring element, which I do, and I do it fairly intensively. I only took on 40 people, and only half of them do I do that 20 minutes. and I can do it a little bit better now because I'm home and I'm communicating with them on the message, reviewing their food diaries, all of that even more intensively. So I have a very small further non-office-based income from the remote patient monitoring, which I could easily increase. And I think most people could probably find 100 to 150 patients who would like that option as well.
Great. Thanks, Larry. And Bob, I've got the same question for you. How has the pandemic affected your practice?
Well, it's had a dramatic effect. However, our office is open. We have the same hours. Just as Larry mentioned, I have all of my employees. No one's been furloughed or terminated. We're completely supportive of our employees. I did a little math calculation. Over the past month, the average number of patient visits per day has been about 4. And the vast majority of those, and I'll explain that in a little bit, the vast majority have been either televisits or virtual visits. Compare that to the month prior to that, probably the average number of patients that I would see in a day with this personalized care practice is about 10 per day. So you can see that there's been at least a 60% reduction in the number of office visits daily, and the reduction in fee-for-service revenues probably exceeds that because we obviously don't do the same degree of complexity billing in our virtual visits as we do in our inpatient visits. What we do when we go through the schedule, we call the patients and we offer them the following options. They can delay their appointment for 4 to 6 weeks. They can schedule a virtual or televisit, as we are doing, or they can come in for a personal visit if it's compelling, if it's something that we really have to see them for, and obviously nothing related to COVID-19. And I think there are some relevant points to make about that. The vast majority of the patients have opted simply to move their appointments out 4 to 6 weeks. And I think the important aspect of that is, number one, in this kind of population, they're very adherent. Their medical problems are entirely stable. There's no reason that they have any fear about delaying their appointments for 4 to 6 weeks. And more importantly, they know in that 4 to 6 week period, if some event arises that needs attention, they can contact us immediately. We can either deal with it by phone, we can deal with it by a virtual visit, or we can bring them in for an appointment. And I think finally, they have confidence when we tell them that we're going to reschedule their appointment in 4 to 6 weeks. They know that it will be in 4 to 6 weeks and not 4 to 6 months, which would be sort of the standard in a standard medical practice currently.
Thanks, Bob. Could you elaborate a little more on how the recurring revenue stream from your Signature MD practice has insulated you from the financial hardship that many of your peers are enduring?
Oh, absolutely. You know, I don't think that you could design a more protective program than the personalized care program. And why do I say that? Currently in our practice, 75% of the revenues come from personalized care payments. 25% of the revenues are fee for service. I think the best way to explain this is to set up a little hypothetical model. Let's assume that this pandemic duration is going to be 6 months. Let's assume that the decrease in fee for service revenues is going to be at least 60%. In a traditional practice, that means for the course of a year, that's a 30% reduction in revenues. Add that to the usual overhead of 50 to 60%. As you can see, do the math. There's really not a lot left. The other model, using the same assumptions, 6 months duration, 60% reduction in fee-for-service revenues, the actual reduction in the revenues for the practice is only 7 to 8%. And it's important to point out that you're starting actually from a much higher financial set point. And it's important to stress that you have a continuing revenue stream from your personalized care payments so that you can support your practice, you can support your employees, you can continue to do things in a reasonable fashion, and it allows you to maintain the sanity so that you can be there for your patients.
Thanks, Bob. I think maybe you were the finance major, not Larry, based on that. Larry, do you have anything else to add on the insulating properties of the practice, or Do you think Bob handled that pretty
Well,
well?
I think he handled it. I have two other little things. Number one, the fees from the concierge membership are recurring revenue, not dependent on office visits. And the other source in my practice of a much smaller amount of non-dependent on seeing the patients is offering Medicare Advantage capitation, which I did for those patients who truly wanted to stay and couldn't afford it. And really their secondary insurance was a burden. And I've been able to give them a level, just as Bob indicated with his endocrine consults. I can give my capitated patients almost the same level of care, not quite the same availability by cell phone. But that allowed me to do something very important, which is what Signature facilitates, not having to terminate anybody for financial reasons, either by scholarship or capitation. And the capitation is a recurring monthly check. And my income distribution from the office practice and the concierge fees is about 50-50, but part of that goes to the salary of my employed physician.
Thanks, Larry. Has the concierge model provided any benefits to your practice other than the financial that we've discussed?
Is that for me?
Yeah.
So many. As people used to tell the on-call physician on the weekend, because I hadn't been on call for 30 years, they would call and they'd say, well, I'm a personal friend. And I would tell the on-call physician to tell them that if they were a personal friend, they'd have my cell phone. Now, all of my patients are personal friends. And that means a lot of different things. Number one, you have more time. And I always knew my patients very well. We had a very personalized kind of practice. But I didn't tell my patients about an interesting book or a movie or a Netflix series or what restaurants to go to when they went to Paris or Amsterdam. So there, and I also didn't share lunch with them. And now I have a certain number of patients who make their appointments for the last visit of the morning so we can then go out and have lunch. And it is created in a kind of friendship, family relationship that we always felt we did, but could not do it with the volume that we had. And frankly, I didn't feel the same kind of reciprocal connectivity that the concierge model gives you. It is essentially a patient saying, you're worth something to me. And that is gratifying, remunerative, and much appreciated.
Great. Thanks, Larry. Bob, do you have anything additional to add?
Well, I totally endorse what Larry just said. I think that's the most special aspect of this, is the relationship that you develop with the patients. And they truly are like family. And just as Larry has mentioned, and there are numerous patients now that we even go out to dinner with and have connections with. And it's a situation where they have made an incredible commitment to you, and you are making an incredible commitment to them. And that just totally changes the relationship that you have with your patients in such a positive way. And I look at my colleagues who are experiencing physician burnout and resentment when they have to do things. I can say this honestly, I look forward to doing things for these patients. Anything I can do that enhances the quality of their life, it just makes you feel so good because you have this special relationship. It has also, again, not to repeat myself, but has allowed me to have a sustainable lifestyle, to continue to be a resource to the community in endocrinology. And all of that is just incredibly important. It also allowed me to, when I mentioned earlier, bringing in that young physician to take over the patients who I wanted to have an option, the opportunity to mentor that physician and try to at least show him at least what I thought were the values that were important in practicing medicine.
That's wonderful. Thank you. We've just got about 4 minutes left, so I want to touch on a few questions that came in from the audience. So maybe, Bob, perhaps you could answer this one. Many of my patients aren't wealthy. How can they afford this, especially given the current economic uncertainty?
Well, I mean, look, that's a very important question. And I realized from day one, first of all, there are a lot of assumptions about personalized care medicine, and they're just not true. Within reason, of course, my patient population is literally across the entire socioeconomic spectrum. Again, within reason. I have teachers, I have farmers, I have executives, I have professionals, I have retired military. The unifying factor that pushes these patients to pursue this option is that they truly value their health care. And I really learned it from day one 9 years ago. And I always love to offer an example. It was like within the first couple of weeks of transition, I had two 90-year-old female patients. One was a retired stockbroker. The other was a retired cafeteria worker in a high school. Guess who joined the personalized care practice? The cafeteria worker. And again, why is that? It's because she valued her health care, and it meant a lot to her over the subsequent years.
Great, wonderful, thank you. Larry, quick question on insurance. How is insurance reimbursement affected by the Signature MD model?
Not at all. We still see our PPO patients, our Medicare patients, and charge and get reimbursed the same modest amounts that those third-party payers paid us before. And that's the major source of the office-based visit-generated revenue.
Wonderful. Final question. It's more of a business question that I can answer. When is the timing right to consider converting my practice, especially given the uncertainty caused by the pandemic? So it's interesting. Right now, we are seeing such an uptick in interest from both physicians and patients for our program. We have inquiries on a daily basis from patients who are looking to secure a relationship with their concierge doctor. So although the way we do business has been disrupted, we're doing our meetings virtually rather than in person, now is actually an exceptional time, in my opinion, to start a concierge type practice with one caveat. I think it would be irresponsible to do a full conversion right now, but if one is doing our segmented model where no patients are terminated and where you have continuity of care for all patients, it makes, I think, it is an ethically defensible position. And your patients that are able to afford the program today can join today, and you have patients who might not join today who might join in 3, 6, 9, or 12 months. So that's just one man's perspective. I think we are out of time.
Matt, if you haven't, I can make another point about this. The process of converting your practice, or first you have to assess whether your practice is appropriate. So that process could start now. I would expect that Matt would be creative in doing the survey under these conditions. I wouldn't actually do the conversion because it's important that you're seeing your usual volume and the signature person who's placed in your office to use a business word, close the patients, would not be very effective when you're not seeing your usual volume. But you could have your practice analyzed for appropriateness. And I think each of you would have to think, and Matt would have to give his input, whether it might be a time to even do the survey, because people may feel that their doctor is more important, and he might even emphasize the kinds of other services like telemedicine, like remote monitoring. And one of the things when Matt asked what's different, the most annoying patient, who was annoying when they were a, quote, regular fee-for-service patient, is no longer annoying. I understand that they knew that they were, quote, needy, and I'm happy to fulfill that expectation and that need without a scintilla of resentment. And that's been very important because it allows you to take care of patients who are medically difficult and personally difficult.
Great. Thanks, Larry. I think you made a great point about the lead time. It takes us approximately 60 to 90 days to analyze and prepare for an implementation anyway. So if one were interested today, you're looking at summertime before we'd actually get rolling on an integration. So we are at 6:31 Eastern, 3:31 Pacific. So we should probably wrap this up. I appreciate everybody's time. If there are any follow-on questions, you can email the same email that you were presented with before, which is questions@signaturemd.com. Larry, Bob, I truly appreciate your contribution. Thank you very much. I wish I had your level of eloquence. And to all of you attendees, thank you very much for your time. We appreciate it.
It was a pleasure, and Matt, we appreciate everything that you and Signature has done for all of us. Thank you.
And Matt, one other thing, if they have a specific question, and I'm sure Bob feels the same way, because there are other subspecialties that do provide a lot of primary care, and the ability to maintain your consultative practice and have a concierge practice for your primary care patients is true for nephrologists. I know we have a couple of those in my community. For endocrinologists, as Bob has pointed out, for rheumatologists who often only have their rheumatologist because they're a young person with a major disease. So if you have any specific questions you'd like addressed to either of us, I'm sure Bob is agreeable as well, they can go through Matt and we'll be happy to have direct input. Even talk to you.
Totally agree. Totally support that.
Great. Thank you all.